The idea of a crisis cafe came from the consumer panel, as it was called at the time. It's now the local mental health forum. And they asked I asked Lifelink to have a look at how it could be progressed. Lifelink is an umbrella group for all the organisations in Kilkenny, state, voluntary and community with a mental health remit. And it's a real collaborative, inclusive group. We meet once every 6 weeks or so and we work on projects together. The idea is that nothing will be duplicated among the services and that everybody has a goal for better mental health services in Kilkenny in mind. So when the consumer panel brought the idea of a crisis cafe to us, we ran with it and we looked for funding from Kilkenny Leader Partnership in order to do a feasibility study on how it would look here in Kilkenny. So the idea of a crisis cafe is that instead of going out to A&E if you present with a mental health crisis, you go to a peer-supported, safe place, easily accessible in Kilkenny City in order to de-escalate that crisis. And a lot of the evaluation from a similar project in the UK indicates that it reduces the amount of people who end up in the Department of Psychiatry and has better outcomes for the people involved. Sometimes all it needs is somebody to sit down to you to listen to what you say and to signpost you to places where you can go in order to de-escalate. Being out in A&E in St. Luke's in the hospital is not a place for a person who has a mental health crisis. It's not fair on them and it's certainly not fair on the people who are out there with other issues. It takes a long time to get seen to and it's the only point of entry for somebody with a mental health crisis. So the idea around the Crisis Cafe is a brilliant one and it's something that's unique in Ireland. Galway have looked at one but they have come from it from a different perspective to us. We have looked at the feasibility of where it will be, how it will look, who will be involved, whereas Galway have looked at it from setting up a pilot study and going from that direction. So in Ireland, this is quite a unique project and one that Lifelink and all of the mental health services in Kilkenny are very passionate about.
Important part of a good crisis cafe is finding the proper balance. That it's not over clinical, but yet that little piece could be needed. And I think the huge part in it, we say, is the peer support work. That calming atmosphere, a person that understands what person coming in, presenting themselves in crisis is about. People that with the lived experiences can draw on that and with proper training to go on to become great support workers and I suppose make a big difference in mental health.
Hi, my name is Noel Cantwell. I'm a volunteer with Kilkenny Involvement Centre. I have many responsibilities and it's great to mix in with people there to develop rapports and interaction. Regarding Crisis Cafe, it would be a brilliant safe haven for people to come to out of hours, especially say Sunday for example, psychological, physical issues regarding distress and stress levels. It would also be beneficial to alleviate and disperse current people who are frequenting the premises to maximise the output for them to feel good and feel great about frequenting the premises, whatever the timetable suits. Also, we're here to help people who have anxiety issues, for example, me myself included. This can be alleviated through chemical substances and also places of respite where we can actually encounter and try to help people, whether it's a cup of coffee, a movie, whatever. And I've found four, 5 or 6 friends out of this place now. I've been there 6 years. I've developed a great bond with people, recreational and psychologically as well. Just to reiterate what my boss, coordinator Paul Clifford, said about lived experience, trying to negate recovery, relapse prevention, self-advocacy and stigma, treatment, distressing beliefs and voices. All these can be tapered and reduced through what we have to offer through a crisis cafe. Thanks.
Workhorse Union led the feasibility study for the Crisis Cafe and we worked very closely with Lifelink to develop a process of co-production through a series of workshops. And those workshops were about bringing people with lived experience and professional experience together to really, I suppose, workshop what were the kind of core themes that a crisis cafe would have to what are the core themes that we'd have to look at in terms of imagining a crisis cafe in Kilkenny. So we looked at the themes of support, of crisis, of collaboration and of governance. And from those, I suppose, really bring together the kind of diverse voices and experience, we were able to then put together the feasibility study, which I think sets out a really ambitious and very exciting proposal for Kilkenny. I suppose one of the really strong things that came out of the feasibility study was the kind of rich tradition of voluntary and community activity and services in Kilkenny, and that opportunity for collaboration between KLP, the HSC and the community and voluntary organisations was something that was, a real asset to setting up a crisis cafe in Kilkenny, and there's a real that this is a feasible project, and we really were able to identify that there were those organisations already working together, and there was a possibility for them to work together on a project that is going to be really innovative and I think groundbreaking in Ireland.
KLP got involved in this project through our work with the Lifelink Committee under the SICAP programme. The SICAP programme provides a range of different supports, including supports for leveraging of funding, supports for organisation development, and in terms of delivering the vision for Crisis Cafe in Kilkenny, and the first step being the feasibility study itself. The Rural Development Leader Programme provided funding for the study to take on the consultants to do it. What we would like out of this project is, first of all, that there is a community response to mental health in Kilkenny, and also collaboration with all the key stakeholders involved in the project to date,